So I'm going to take you through module two so you kind of get your bearings, and then I'm going to turn you loose and see what you guys come up with. So, as we progress through, now we're into module two. Module one was just kind of getting your feet wet so you kind of understand this new language that we have of bioethics. Now it's time to really get into it. Our first ethical dilemma is the professional and patient relationship, the medical professionals and the patient's relationship with each other. This is the heart of it. It doesn't matter what the dilemma is, it doesn't matter what the crisis is, because the very first thing that you are going to deal with in a hospital or medical setting is the relationship between each other, the relationship with the medical staff, the relationship you have with the person having the dilemma, your relationship and your understanding of yourself and your well being. That's where it all starts. It's very emotional, it's very passionate, and that is where we want to focus our attention first. So, let me take you through the module. So, as you come through here, you will see that I have a handful of things for you. The first one are some slides. As you go through these slides, you could expand them and it'll take up your whole screen. You could click this button right here and it'll give you grid view. Grid view will show up when you expand it. You can even download these slides to your own computer, and these just kind of take you through what is the topics. It helps if you don't have your book. And I even have little videos there for you. And then you have, like I said, we don't have a book, so I have stuff for you to read. Now, these are taken right from medical journals, so they are very wordy and they're probably in a language it's hard for our minds to get used to. So do your best to go through them. I usually try to stick with the introduction myself, and then I kind of bounce around down here to the discussion area. And then once I have those two, now I can kind of go back and understand what they're saying to us. So that's kind of helps you get through these. Like I said, these are very analytical, but what I like about them is they give you an idea of what the root is. So this is going to be the doctor talking to you, the expert in the room, and this is me kind of bringing us kind of into an area that we might be able to understand a little more clearly. All right, so what we have for this week is here is your module material. Again, you see it's quite a lot. You won't necessarily need all of it, but just pick what you need. You have your quiz as usual. And then remember, you have a quiz prep. This is going to tell you all of the questions ahead of time. It's going to give you materials to have off and to read. Again, these are from the doctors in the room, so they're very intense. So I would run through them first, kind of picking out what's useful. And then for your assignment this week, now this is where it gets fun. You see how it says pick one? So I hate reading the same thing every single semester. And that's so unrealistic because there's so much information we could possibly have. So sometimes these folders will have two, four. I'm actually working on a new module that's going to talk about conspiracy theories in the medical field of myths and AI and all that type of stuff. So there's so many areas that we could tackle. And if there's an area you don't see in the class, please let me know because I'm always trying to pack this class with what's relevant. So this time around, you have two choices. You have an essay about what is the nature of a nurse, what makes a good nurse, what makes a good bedside. Now remember, a nurse is different than a doctor, and a doctor is different than a surgeon. And these are all different than specialists. It's very micromanaged. So we want to stay in the lane of a nurse. So this would just be an essay. So what you would do is you're going to go back here to the modules and you're going to pull out the relative information that deals with what does it mean to be a good nurse. And this is going to be a lot to do with paternalism and what's best for them, being a patient advocate. So that's why I would focus on that one. Now, if you don't want to do that, I do have a discussion. Now, unlike the essay where it's just contained by itself, you post and go. A discussion, you are going to talk back and forth with each other. So if you do the essay, bye, bye. You don't have to come over here. But if you stick in the area of discussion, then you are expected to talk back and forth with us. So for this one, we're talking about confidentiality, paternalism, patient autonomy, and truth telling. There's a lot of handouts in the materials folder that you're going to use for this. You're going to read this first. and then go back to that folder and pull what you need. So anytime that you're doing these assignments, you are pulling what you need from here, you're pulling what you need from those slides in the foundational chapter, thinking really hard on it, and then sifting it back into what you want to talk about. So remember, use me as your resource. I'm here to help you. I can steer you in the right direction, usually more relevant so than what you would find online. So please, for the love of God, use me instead of going another route. So, all right, that's what we're doing this week, this module. Let me know if you have any questions, and I'm here.